Hello everyone, thank you for joining my session. My name is Alana Esty, and I'll be providing an overview on the common skills used in the health informatics field, and specifically in the healthcare data analyst role. I'm also going to be providing some tips on how one can prepare for applying for jobs as a healthcare analyst. So a little bit about me. I have my background in biomedical engineering with a focus on analyzing healthcare data to improve patient outcomes. I currently work in the health informatics space in Ontario, Canada. And during the pandemic, I began a podcast called the Health Analytic Insights as a way to provide tips for people to break into the health informatics field and meet other aspiring informatics enthusiasts during an isolating time. During the 3-year run of this podcast, I had an opportunity to interview many people who broke into the field. And in this session, I hope to provide you with some of their advice, along with some advice of my own, to help others who are interested in the field of health informatics. So in this presentation, I hope to answer questions such as, what is health informatics? What are some common skills in the field? What does a typical day in the life look like? What are some job roles you can apply to today? And how can you increase your chances of getting a role in this field? So just going down to the basics, what is health informatics? This is a quote that I sourced from the Healthcare Information and Management Systems Society website. It's a great website if you're new to the field and want to learn more. They have a huge repository of blogs and even some job opportunities. So definitely check out that website. So this is the quote that they've defined health informatics as, which is the integration of healthcare sciences, computer science, information science, and cognitive science to assist in the management of healthcare information. I like to define health informatics as simply transforming raw, messy, unstructured data into actionable information to improve clinical workflow and ultimately patient outcomes. So how can technology positively impact healthcare? Healthcare organizations collect huge volumes of unstructured and structured data, from medical images, lab results, administrative data, electronic health records, and much more. Being able to make sense of this raw data and transform it into information for actionable results is a large part of the healthcare data analyst role. If you take an example you might be able to relate to, whether through budgeting, having a Fitbit, or keeping a food diary, there can be positive impact of tracking personal metrics on your overall lifestyle. Human beings are notorious for over or underestimating situations, and being able to track things is key to being able to making informed decisions. So looking at a healthcare example, during the height of the pandemic, many hospitals paused elective surgeries, and this was the case at Phoenix Children's Hospital. The issue they had was how to resume the deferred surgeries after the peak of the pandemic in a timely and efficient manner. To support this, a dashboard was created, and you can see this dashboard pictured in the image on the slide. And this dashboard can be viewed by multiple surgeons and support how they would prioritize these deferred surgeries. Instead of having a disorganized system of emails, paper notes, and other files, this dashboard housed necessary centralized information where clinical staff could easily navigate and plan their schedule on a day-to-day basis. Specifically, the creation of this dashboard allowed surgeons to review cases and assign priority from high, medium, or low to both backlogged and new cases. Dr. Vaidya, Chief Medical Information Officer at Phoenix Children's Hospital, stated about the dashboard, the technology allowed for synergies across the enterprise in addressing the multifaceted challenges of resuming these operations. So here we see a prime example of how health analytics can make a significant difference in improving hospital operations, workflow, and bringing different departments within the organization together. This example does not exist in isolation. If you do a search in Google Scholar, you'll see several examples of how clinical dashboards can be part of the solution to improve patient care. So now on to highlighting some of the common skills in the health informatics field. If you look at enough job descriptions, you'll start to see patterns on key skills that are often advertised for roles in the health informatics field. These skills include some clinical experience. This could be obtained through previously working as a nurse, pharmacy technician, clinical research assistant, or at the help desk in a hospital. It can also be through a degree, obtaining your master's in health informatics. You might also see these roles advertising for people who have experience with data visualization tools. This can be something as standard as building a chart or graph in Excel to experience with more advanced tools, such as Power BI, Tableau, or Click. If you're interested in learning more about data visualization, I would suggest downloading Microsoft Power BI Desktop, which you can do for free, and searching for Power BI through a website called Microsoft Learn. This website contains tons of free tutorials where you can beef up your data visualization skills in this space for free. There's also tons of tutorials on YouTube as well, where you can learn and upskill in the data visualization space. One programming language that you might see advertised over and over again for health informatics roles is experience with SQL, which stands for Structured Query Language. This is a language that is used to interact with data stored in databases. With the move to digitizing healthcare records, the amount of data that is stored and collected in healthcare organizations has exponentially grown. This is one of the reasons why a career in health informatics can be fulfilling, as problems are always changing. There's never a dull moment. To be able to sort through all the different types of healthcare data that exists, from healthcare claims, blood work data from the labs, and patient demographic information, to name a few, SQL is used to sort through tons of data and organize messy data into actionable information. Later on in the session, I'll give a concrete example of how this can be done with writing SQL queries. Finally, strong communication skills are key in most roles, but it is especially important in the health informatics field. Oftentimes, you'll be the analytical translator, and this is a term that I found from a McKinsey article which describes the health informatic role to the T. One day you might be meeting with clinicians and developing requirements on a program or report they would like to see developed, which helps them to better track certain clinical metrics. Another day you might be working with a software development team to actually flesh out these requirements and understand how long it's going to take to build. And so you'll be in the in-between between the clinician and IT to develop a report or solution that clinicians are looking for. So let's get into what a typical day in the life might look like. Patients being readmitted back into hospital is a costly issue. For example, in 2018, the Canadian Institute for Health Information estimated readmission to hospital costs more than $2.1 billion a year in Canada. And most importantly, it can often lead to negative effects for the patients. There has been research which has shown a reduction in patient readmission rates when there is a follow-up call. This could help medication adherence and also help patients feel more supported. Imagine your boss wants you to create a report which can determine which diabetic patients might be at risk for readmission back to hospital, so that this information can be flagged to community nurses who are carrying out the follow-up with patients. You might think the first step is just to dive into the data, but actually the first step would be to have conversations with clinicians. You want to make sure you're fully understanding the problem before doing any additional analysis. This could look like asking the community nurses, what tends to be the key characteristics of patients who are often readmitted back to the hospital? Do they tend to be on several different types of medications? Is it age-related? This is where your relevant clinical experience can come in handy to help guide your questions. Once you have the correct frame of reference, then the next step would be to sort through the data. So I want to provide a disclaimer. What I'm showing here is a fake data set and doesn't contain any real patient health information. The data set represents 10 years from 1999 to 2008 of clinical care at 130 US hospitals and integrated delivery networks. It's sourced from a research paper titled Impact of HbA1c Measurement on Hospital Readmission Rates, Analysis of 70,000 Clinical Database Records. And so here what I'm showing you is writing SQL queries and how it can be used to sort through the data. So here I'm selecting the patient demographic table, and you can see it contains information such as the gender, age, weight, the patient ID. And now I'm selecting the patient diagnosis table, and this table has a lot of information in it. It has the number of medications that the patient is on, and it also has a very important key column which shows if the patient was readmitted back to hospital within 30 days. And so the purpose of this is to basically join the patient demographic information to the diagnosis table for a more fulsome analysis. So now you can combine information such as age and gender with some of the diagnosis information if you have a common column between them. And the common column between these two tables is the patient health card number. So now I've written a SQL query which has joined both the patient demographic and the patient diagnosis table with a common column which is the encounter ID. So this is just an example of how you can write SQL queries to really dive into the data by connecting tables of information together and doing further analysis. And here I'm showing an example of using a tool called Power BI. And one of the great things about Power BI is it allows you to summarize the data. You don't want to just send, your raw, messy data to clinicians when you're trying to communicate insights. You kind of want to summarize the data into what is your key findings. And Power BI is a great tool to do this. It has a lot of filtering capabilities. It's very interactive. So you see when I select one of the bars here, it changes the numbers. And it really helps you to tell a story. So clinical business intelligence portfolios can be used to showcase the technical skills you've learned. By choosing a common problem within healthcare analytics, such as readmission rates, and then documenting your steps through a GitHub account or creating a website, or documenting your steps and linking this as a resource in your resume, this is a great way to show off your technical skills. And you can use tools like Power BI and SQL to really boost up your portfolio. So just to recap, this is what a typical day in the life of a healthcare data analyst might look like. Step 1, have conversations with clinicians to really get clear on what the objective of your analysis is. Step 2, sort through lots of data by writing SQL queries. Step 3, summarize your findings in graphs and tables using a tool such as Power BI. Present your findings, and oftentimes this is really a cyclical structure because once you present your findings, oftentimes more questions arise, and then you start back at the top again until you both come to a consensus. So oftentimes I'll get this question from the listener of the Health Analytic Insights podcast. What job should I be searching for? I don't even know where to start. And this makes a lot of sense because this field is relatively new and doesn't tend to have established titles, such as a project manager or a business analyst. Therefore, I advise people to search for a technical tool they might have expertise in, plus the word healthcare. For example, one could enter in Power BI plus healthcare into the search box of Indeed or LinkedIn. And in addition, once you start searching enough, you'll start to see some common job titles. They tend to have the word analyst in them. So for example, you might see job titles such as clinical systems analyst, electronic health record analyst. Some of these job titles might exist where you live, but it can be geographical specific. Another tip, if you currently work in a clinical or healthcare organization, you might want to see if your organization has a business intelligence or clinical decision support department, and see the roles within this department. And if you have a chance, try to connect with your colleagues and attempt to job shadow for some of the roles. So you can either identify any technical skill gaps you might be solved by taking a relevant course to improve your job application. Although getting a job can be equal parts timing and luck, just throwing your resume into the void of LinkedIn or Indeed can feel like you're not even moving the needle. Instead, you can consider developing your technical skills in Power BI and SQL by creating a portfolio project with a clinical lens to help develop and showcase your technical skills, especially if you already have a strong clinical background as a nurse or pharmacy technician. Creating a portfolio project can show to hiring managers that you also have the necessary technical skills, which can help strengthen your application when applying to jobs. So I've had the opportunity to review several resumes from individuals looking to break into the field, and what I often see is a simple listing of Power BI or SQL. Being able to show concrete proof of your proficiency with these technical tools in the form of the creation of a project can be a boost for your application, especially in this competitive job market. So here I'm showcasing a course that I have through Gumroad, and as a thank you for attending this session, I have a discount code for individuals looking to go through this course. The discount code is ELEVATE, all capital letters, ELEVATE, and it is for 10% off on both the ultimate guide that I have written as well as the course, which helps you to develop your skills in SQL and Power BI. And this discount code is valid until April 30th, 2026. Again, you can find it through Gumroad, and it's titled Learn the Skills to Get Your First Role as a Healthcare Analyst. One of the major hurdles to creating a clinical portfolio project is the lack of open source clinical datasets which exist because of the risk of releasing personal health information publicly. Therefore, you can find tons of data analytical courses using the popular Microsoft AdventureWorks dataset, but it is much harder to find an analytical course with a clinical lens. And this is something that I struggled with when I first pivoted into this field, and I've created an online course with a clinically focused dataset, which you can use to create your own portfolio project. I also walk you through in detail how to write common SQL queries, and we walk through step by step how you can build your own hospital key performance indicator dashboard using Power BI. As a result of completing this course, you can showcase this dashboard with a unique link that can be embedded in a professional blog or hyperlinked in your resume for hiring managers to see. Completing this course will provide you an opportunity to speak to the specific data cleansing methods you applied and the overall technical skills you have developed. Again, there's a discount code, ELEVATE, for 10% off both the guide and the course until April 30th, 2026. So just to wrap up this session, here are some quick tips on how to enhance your resume if this is a field you're interested in pivoting into. If you have a clinical background, I would highlight this in your resume summary and any technical skills you have gained through self-learning or taking classes. Vice versa, if you have technical skills and are looking to work in a healthcare organization, highlighting your technical skills in your resume summary, and then any volunteering or internships you have done within the hospital or healthcare system will be good to emphasize. I've had a chance to review several resumes, and one thing I've noticed, especially with clinical individuals looking to pivot into the technical field, would be that they forget to include the experience they have with electronic health record systems, such as Epic and Cerner, especially if they were in a super user role, where they had additional training and might have trained others. This is really valuable to include on your resume. Earlier, I talked about the clinical business intelligence portfolio. If you have no prior experience, it might be good to create a project which goes through the steps of solving a current healthcare issue, such as readmission rates, using open source data sets, and documenting the data cleansing steps, the statistical analysis, and exploratory data analysis that you did to arrive to the conclusion of your project, and then visualizing that information using a tool such as Power BI or Tableau to summarize your end results. Finally, linking the portfolio project you developed in your resume might be a great way to stand out to employers. So I hope this session has been helpful. I have a link to my newsletter here where I provide job posting, tips on how to break into the health informatics field, and helping to keep you up to date on this rapidly changing field. Thank you so much for your attention, and I hope you have a good rest of the day.